Okay, we're going to move on to our second panelist now, who's Dr. Rod Elford, and he's going to be leading us in communication issues during a pandemic. As I mentioned, I'm intrigued by bridge people, and Rod is a bridge person as well. He bridged medicine and information technology and telecommunications, and was one of the first physicians in Canada to do advanced training in telemedicine. Today, he is the medical coordinator of HealthLink Alberta. That system is in existence throughout this province, where 24/7 it can be contacted by one of our citizens and their health problem discussed with a professional who will give them advice as to what to do next. HealthLink is in the process of moving from just being a responder to requests to starting to influence change by reaching out without a request. And this pandemic issue is an example of where that might indeed be very helpful. So Rod, we're looking forward to hearing your thoughts as to how HealthLink Alberta might become a communication link in this process. The reason, though, my knees shake when I introduce Rod is not because he's a bridge person, but because he's my son.
Thanks. I'd just like to thank Mark for the invite. In the health region, and in my mind, until recently, we had never really thought about pandemic planning and faith communities in the same sentence. We thought about it on the back burner, but we really didn't think about how do we truly engage them in a dialogue to move forward. My background is I did family medicine and then specialized in telehealth. And for 10 years, I worked inner city here in Calgary at 8th and 8th, worked with the marginalized population. And I ran a telehealth company that set up telehealth up north to link people in really remote locations, Nunavut, to places down south to meet a healthcare professional if required. But a couple of years ago, my focus changed. I just want to let you know why. My focus changed is because I was reacting to the problem. All these people would come and see me, and the waits got longer and longer. And no matter what we did, the waits got longer. The problem continued. And so I began to think about, is there any way we can be more proactive? Can we prevent some of this demand that's hitting us? And the problem is, our system now is at capacity. And if we have any type of disaster, we're going to be overwhelmed. So the healthcare system is going to be overwhelmed, which means that we're going to need the community to help us. So the other role that I have is called citizen engagement. I'm hoping that this will continue. Today we expect an announcement on if there's going to be 9 regions or less. And that may change the focus of the Calgary Health Region. They actually have a portfolio called citizen engagement now. And I'm hoping that this will continue, because I believe this is important. For pandemics, or any type of disaster, it's much easier to explain why you planned and why you didn't. I think you've probably seen this. Just wave your hands if you have. There's been a pandemic plan nationally, provincially, in the city, and the Calgary Health Region just updated theirs. And I think they've done a good job. That's their website. I'm just going to go... So if you want to get more information, you can go to the Calgary Health Region external website. There's a lot of helpful information here for health information. If you want to go to pandemic, you can just put in pandemic, and there's a lot of resources here that you can access. There's a number of different documents that you can use or hand out they're public. Use them in your community. So these are a number of the different documents that the Calgary Health Region has prepared, and they're quite good. I'm surprised that we've actually are as prepared as we are. But I think we are because what happened a number of years ago with SARS in central Ontario is Toronto got hit big time. They weren't prepared. And one of the outcomes of that was people got sued. That's not a good reason to prepare, but it has been in back of people's mind, and it is a good idea to plan ahead. So from my perspective, a lot of what we do at HealthLink is communications. And we work with the health region, and they've divided into pre-pandemic and during the pandemic. And you may want to think of it this way for your faith communities as well. At the beginning, they want to mitigate or just increase the awareness, like we're doing today. This is a great conference for that, and we need many more of them, not just within the faith community, but other community organizations. And then during the pandemic, we're going to have an organized, planned communications to the public and to health professionals. And we want to use best practices. So what do we expect during a pandemic? Well, there's going to be a huge demand for information. And we're going to have to get to people quickly, and it has to be correct. And we have to communicate not just to the public, but to the physicians, the healthcare professionals, and all the community groups that hopefully will engage. What else do we anticipate? We're not going to have a lot of staff. I mean, the regional plan for Calgary says it'll be 1/3 of the people will be affected in 2 different ways. So that means 1/3 of the staff are going to be sick. The other problem is, at that time, we also need to increase our 24/7 coverage, because the problem is not going to be 9 to 5. And we also expect that we're going to become much more centralized in our communications. So we're hoping to draw on a lot of the strong relationships that we already have now, but I hope that we also develop more of them, especially with the faith communities throughout Calgary and the province. We're also going to look at different channels of how to get information out to people. And Alberta Health and Wellness says there's going to be a public awareness campaign. So people have thought about it, and they are prepared. And in my role at HealthLink, what is our role? We're to be the trusted source of health information for the province. So if you have any questions, you can call us. You can call a HealthLink nurse. And we will also have websites and other forms of other channels to get information to you, and other channels to get information from you. The other point here is that the regions and HealthLink work very closely together already. We've gone through a number of mini pandemics, like mumps just recently. We had to know how many people were having mumps in the southern part of the province, and then we had to coordinate a vaccination for mumps. That mainly affected university-age people, but we were part of the communications plan and part of the way to get people into the healthcare system. So what does HealthLink Alberta do? I don't know if everybody's familiar. We're a contact center that if you have any health questions, it doesn't have to be a pandemic. If you have any health questions at all, you can call and talk to a nurse 24/7. It can be an emergency, it can be something minor, it doesn't matter. Go ahead and give us a call. I'll give you the number in a bit. We can also help direct you through the system, help you navigate through the system where you need to go. And finally, we also have 2 different websites. Inform Alberta Talk is like Yellow Pages for healthcare. It's got all the different health facilities in the province in it, and you can look it up and find out how to get there and their contacts. HealthLink Alberta is health information. So you could, if you want to learn about pandemics, you can go to HealthLink Alberta and look it up. So this is just a picture of some of our friendly, competent nurses. And it's one of the few organizations in healthcare that has a consistently positive citizens say wonderful things. They say, every week I have to sign letters of commendation to our nurses who do a great job, and I get so many of them, my hand gets sore. And people phone in and they say, I called you and I wasn't going to go to hospital, but you said I should, and the doctor said if I hadn't got here, my appendix would have perforated and I probably would have died if I'd waited too long. Now, HealthLink didn't save that patient. The system didn't really save the patient, but everything in the system had to work together. And when it worked together, it benefited the patient, benefited the citizen. And I think faith communities are going to be part of that continuum. So HealthLink, we've thought about, during a pandemic, if you called us, we're not going to have enough staff. So we're going to have pre-recorded messages that you'll listen to. Then you have to hit a button that'll tell you, maybe where you need to go in the community for help, or if you need information, or where you need to go. We'll probably direct you to a website, to get more information. And if you're lucky, you get to talk to a nurse in person. So what we're doing is we're generating a whole bunch of pre-recorded messages, because we're not going to have people to give them. We'll need to have them pre-recorded and ready to go during the pandemic. And in the future, we're also looking at, are we going to have a pandemic portal for the whole province to go to get information? Is that going to be a provincial portal, a HealthLink portal, or regional? We don't know yet. They may all be mirrored, meaning look the same, to be decided. Another interesting thing that we're doing at HealthLink is we're piloting this. It's called remote agents. Instead of the nurses coming all together during a pandemic, all together, sharing keyboards, not a good idea. We're going to try and have remote agents where people can stay in their home and take calls from home. So we just started that, and hopefully that project will go well. This will allow us not only to help increase retention and recruit people, but during a crisis, people will be able to stay home and still help. But it comes back to what can you do? What can faith communities do? Initially, I thought, if government tells you to do something, how often do you do it? Sometimes, usually. But if a leader in a faith community tells you that you should do this, you probably will. There's more likelihood that your leader in a faith community, that you trust them, that you should trust what they want you to do. So that was my initial thinking. But the talk Andrew gave at lunchtime, he said a strong community had better health outcomes. It wasn't one with better hospitals, better doctors, better nurses. The ones with a better, stronger community had better outcomes. So it's always better to plan ahead. It wasn't raining when Noah built the ark. So I think increased awareness and understanding, and you're doing that today. This is great. And then once we know what to do, we can start to prepare. And continue dialogue with health regions or other stakeholders so that we're coordinated. But I was thinking about this after lunch. I don't really think that's the biggest benefit that you can have. The biggest benefit could start pre-pandemic, where you start to promote community more, establish links, make sure you know who's in your community, who's in your church, so that if there is a problem, you can connect with them. Make sure they're okay. Who's my neighbor? This may be an opportunity for churches to start engaging more outside their own walls, within their community, to get more people outside of the walls into the church. And then during a pandemic, what do we do? Well, I said respond in love. But it was very sad to hear that during those heat waves, these people died alone. And during a pandemic, we're going to recommend people stay at home, that they stay isolated. But they don't have to be isolated. We can call them. We can talk to them. We maintain a connection with people even though they're physically separate. And I think the church, faith communities, this is a great area of opportunity. And the other area of opportunity is we don't have to wait for a pandemic to do this. So the health region has begun to think about faith-based communities and how we interact with them. And you saw this today. This is just hot off the press. It's not even on our website yet. But it's a checklist of ways that you can prepare for a pandemic. And we're hoping at some point to have more than this, a whole toolkit to help you. So the future for the health region is we'll have that on the website I showed you. They'll have the toolkits. So they are starting to think about it. And I think this is a good first step to begin the dialogue. So that's all I have for my talk today.